Question number 401. Other name of gas sterilization is option A disinfection, option B autoclaving, option C hot air sterilization, and option D fumigation. So option D fumigation is correct answer, because in hospital fumigation is a critical process of sterilization by using the chemical like hydrogen peroxide, formaldehyde to kill the bacteria, fungi and spores. Question number 402. The sudden fall of temperature to normal is termed as option A crisis, option B lysis, option C decline, and option D stadium. So option A crisis is correct answer, because dramatic decrease in temperature from a feverish stage to the normal, often signaling the end of an infection phase. Question number 403. The fall of temperature in an zigzag manner is to the normal is called option A crisis, option B lysis, option C decline, and option D stadium. So option B lysis is correct answer, because lysis refer to the gradual and stepwise decline of the high fever back to the normal body temperature over the several period. Question number 404. Detention of a well person who have come to contact with infectious disease for a period equal to the longest incubation period of the disease. So option A isolation, option B quarantine, option C asepsis, and option D disinfection. So option B quarantine is correct answer. Question number 405. Smith test is conducted for option A albumin, option B acetone, option C bile salts, and option D bile. So option D bile is correct answer. Question number 406. Immediate disinfection of all the contaminated article during the course of disease. So option A terminal disinfection, option B concurrent disinfection, option C sterilization, and option D autoclaving. So option B concurrent disinfection is correct answer. Question number 407. Which part of the nursing process include the statement of the client actual or potential problem? Option A assessment, option B implementation, option C nursing diagnosis, and option D planning. So option C nursing diagnosis is correct answer. Question number 408. A nurse is taking a blood pressure. So which of the following action will give the most accurate reading? So option A using a cuff that covered the 2/3 of the arm length. Option B positioning the patient arm above the heart level. Option C deflating the cuff at 10 mm Hg per second. And option D having the patient sit quietly for at least 5 minutes before measurement. So option D having the patient sit quietly for at least for 5 minutes before taking the blood pressure is correct answer, because resting before measurement ensures the blood pressure accuracy. Question number 409. Which infection control practice is correct here? So option A recapping the used needle with one hand. Option B wearing gloves when giving the oral medication. Option C performing the hand hygiene before and after patient touch. And option D wearing the N95 mask for all patient care. So option C performing the hand hygiene before and after patient contact is correct answer, because hand hygiene is the most effective method of preventing the transmission of infection. Question number 410. So which action reduces the risk of fall in hospitalized elderly patient? Option A raise all side rails. Option B provide non-slip footwear. Option C dim hallway light at night, and option D place the IV poles on the opposite side of the bed. So option B provide the non-slip footwear is correct answer. Question number 411. Common signs of child dehydration are option A sunken eye and dry mucosa, option B edema, option C pallor, option D hypertension. So option A sunken eyes and dry mucosa is correct answer, because classic signs include the sunken eyes and dry mouth. Question number 412. A patient undergoes laminectomy in the immediate post-operative period. So nurse should option A monitor the patient vital signs and log roll him to prone position, and option B monitor the patient vital signs and encourage him to ambulate. Option C monitor the patient vital signs and auscultate his bobble sound. And option D monitor the patient vital signs and check the sensation and motor power of the feet. So option D monitor the patient vital signs and check the sensation and motor activity is correct answer. Question number 413. A patient admitted to hospital in hypertensive crisis is ordered to receive the hydralazine 20 mg IV stat for the blood pressure greater than 190 by 110 mm of Hg. So the best response of the nurse to this order is to option A, give the dose immediately and once. Option B, give the medication if blood pressure is more than 190 by 100 mm of Hg. And option C, call the physician because the order is not clear. And option D, administer the dose and repeat as necessary. So option A, give the dose immediately and once is correct answer. Question number 414. Method to diagnosis and locate the seizures. So option A, EEG. Option B, PET. And option C, MRI. And option D, CT scan. So option A, EEG is correct answer. Question number 415. The primary goal of therapy for the client with pulmonary edema and heart failure is option A, enhance comfort. Option B, improve respiratory status. Option C, peripheral edema decrease. And option D, increase the cardiac output. So option number D, increase the cardiac output is correct answer. Question number 416. A dull percussion is noted over the symphysis pubis and it may indicate option A, pelvic inflammatory disease, option B, prostatitis, option C, peritonitis, and option D, distended bladder. So option D, distended bladder is correct answer. Question number 417. Best time to check the IOP, intraocular pressure. So option A, early morning. Option B, afternoon. Option C, late evening. And option D, at noon. So option A, early morning is the best time to check the intraocular pressure. Question number 418. Which of the following is a characteristic of reassuring the fetal heart rate pattern? So option A, fetal heart rate of 180 beats per minute. Option B, a baseline variability of 35 beats per minute. And option C, a fetal heart rate of 90 at the baseline. And option D, acceleration of fetal heart rate with fetal movement. So option D is correct answer because option A, B and C indicate the ominous finding on the fetal heart monitor, and so these all are the incorrect in this instance. So acceleration with movement are the normal. So the answer D is reassuring pattern is correct answer. Question number 419. The nurse is caring for a client with systemic lupus erythematosus. So the major complication associated with systemic lupus erythematosus is option A, nephritis, option B, cardiomegaly, option C, desquamation, and option D, meningitis. So option A, nephritis is correct answer. The major complication of SLE is lupus nephritis, which result in end-stage renal disease. Question number 420. When giving the post-operative discharge instruction a patient who has had abdominal surgery, so all of the following regarding the wound healing are true except. So option A, bathing to soak the abdomen is preferred. Option B, avoid the tight belt and cloth which seems that they rub the wound. And option C, pain medication may affect ability to drive. And option D, irregular bowel habits can be expected. So option A, bathing to soak the abdomen is preferred is correct answer. Thank you.